I think that a lot of what holds people back is the fear of the unknown. And so you have to be comfortable with the person who's going to do the procedure on you. So I think that's first and foremost when you go for a consultation, that whoever you're talking to actually you vibe with, that you actually feel comfortable with. And then once you overcome that hurdle, I think it's easier to take the plunge.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Troy Callahan from Northern Jersey Plastic Surgery Center. He is a board-certified plastic surgeon and chief of the Department of Plastic Surgery at Englewood Health. He is also the owner of the Northern Jersey Plastic Surgery Center, located in Englewood, New Jersey. He's been in practice for 17 years and specializes in all forms of breast surgery, including reconstruction for cancer patients. He also performs a wide range of aesthetic procedures, including body contouring. So Dr. Callahan, welcome. Glad to have you here.
Thank you, Daniel. Appreciate it.
Yeah, so I'm just curious, let's dive right into it. How did you first get interested in the aesthetics industry?
I think that as a plastic surgeon, that's part of our training. So it's always been a part of what I did. I do mostly reconstructive type of surgery, but a fair amount of what I do, or that part of my practice, has grown over the years as many of my reconstructive patients became aesthetic patients as well.
Okay, got it. Now, can you discuss some of the more popular treatments that your patients come to you for, and also why do you think that they're so popular?
I think a lot of what I do is breast and body contouring, and a lot of my patients come to me for that because I do a lot of it, and they've experienced me operating on them at some point, and then they have friends and family that need to have something done, and so I get referrals, those sources as well. So it's kind of naturally grown and blossomed over time, where these patients who may have started as reconstructive patients kind of converted into cosmetic patients. And so the contouring and the breast stuff still is the majority of what I do, but that's kind of branched out into a lot of the aesthetics with the non-invasive stuff that we do in the office, facial aesthetics as well.
Okay. Now, since you've gone through that transition from really starting off in plastic surgery, then getting more into the non-invasive procedures, are you seeing any new or emerging treatments that you're particularly excited about, particularly when it comes to the body contouring side?
I think that as the technology has gotten better over time, there's many machines that exist, and that's certainly not new. But the technology has improved slowly but surely. Older technologies such as even, I guess it's not that old, but like even cool sculpting is a non-invasive, technology, but it's somewhat old and not used nearly as much because the results aren't as good as what you can get from the newer machines with the radio frequency devices, and the laser devices have better outcomes and safer results in a lot of ways. So I think that as the technology has improved, doing minimally invasive or non-invasive procedures in your office, which doesn't require a trip to the operating room, the resultant downtime and healing time has become much more popular.
Okay. Now, when it comes to the technology, I'm glad you brought this up, is what are you seeing kind of the biggest differences when it comes to the technology getting better and better and better? Are you seeing that it's getting better results, lower downtime, or kind of what's that or maybe all of them? What's that progression you're seeing with the technology? Like what areas is getting better and better?
I think it's both. I think that the results that we're getting are better. I think the downtime is less. Some of these machines that we can use in the office can get you results that are close to what you can get from an operation. So with the body contouring, something where I'd have done liposuction, which is a more invasive procedure, I can achieve similar results in many instances with a machine that doesn't require anesthesia. It can be done with just an external device placed against the skin. One of the machines that I use very frequently is an InMode device called Body Tighten and Morpheus. So it's a radio frequency device. It gets you skin tightening and collagen reformation with pretty good results that mimic things that I can do surgically.
Okay. Now, I want to talk a little bit more about what differentiates your practice from others out there. We talked about in your introduction, you've been in practice for 17 years, but what would you say are some of the other areas that really sets your practice apart from the other ones?
I think that because I have a broad surgical experience and understand the anatomy as well as the results that I can get with surgery, and have that experience with both the pros and cons that come with doing these invasive procedures. As I've gradually and progressively gone into the more non-invasive stuff, I think I can do both aspects very well and safely. So patients who are good candidates for non-invasive procedures feel confident that I'll offer them a procedure that can get them a good result. And if they're not good for a non-invasive procedure, because it's just not going to give them what they want, then I can provide them with a surgical solution that will give them what they need.
Got it. Now, we did also talk about in introduction that you actually do reconstruction for cancer patients. I'm curious, is that something that, how did you end up getting into, I guess, that specialization?
So as a plastic surgeon, we're trained to do, these things. And so I think that when I first started my practice, I was exposed with the hospital Inglewood Health to breast cancer patient population. And so I just saw a vast number of patients that were breast cancer patients and just get referred a lot of that clientele. And so while plastic surgery encompasses a very broad aspect of things from head to toe, like we have patients who are trauma patients that we take care of, there's hand surgery, there's extremity surgery, there's all kinds of surgeries, but a lot of what I was doing from the very beginning had to do with breast surgery. And so whether it's a breast reduction, breast lift, a breast augmentation, or a cancer patient that needs complete breast reconstruction or a new breast made from either an implant-based reconstruction or from their own tissues where we actually have to do microsurgery, able to offer all those options to patients. And so, I've done a large number of those procedures, which, has kind of grown my practice significantly. And so I think that's, how it just started from the beginning, for kind of a fluke almost.
Okay. Yeah, because that's something that I really haven't heard much of as far as doing reconstruction for cancer patients from the plastic surgery side. So I think that was just one really big differentiator that made you stood out, at least in my mind.
Yeah, and I think because I do so much of that and breast surgery in general, I've kind of honed in on that patient population and do a lot of that. I do other things as well, but breast and body contouring is probably the vast majority of what I do.
Okay, got it. Now, Dr. Callahan, how do you approach educating your patients about the treatments and the benefits of what you offer? Because especially in your particular situation, I feel like you're a bit unique and you're doing the plastic surgery side and also the non-invasive side. So, and I'm sure you have a lot of people come to you, they're not quite sure, or they may think that, oh, I want this, but that's not the right fit for them. Or the people that come in and they know what the end result is, but they don't know the path to get there. So how do you approach educating your patients throughout that journey?
I get a really broad spectrum of patients. We have a very diverse patient population here in New Jersey, where I'm at, in Inglewood. I'm in northern New Jersey, not far from the George Washington Bridge. We have a very diverse population when it comes to both body type, race, color, and creed. So some patients come to me with a very specific thing that they're looking for, whether it be for their breast or their body or even their face. And then some patients, come to me saying, oh, I'm not sure what I want. I just want to look younger. And so the approach is different depending on the patient. So if it's somebody who's asking for something specific, I'll sit down and talk to them about their goals and what's reasonable or what's not reasonable to expect as far as what they're going to get or what their expectations are. Because with Instagram and social media, people come to the office with sometimes unreasonable expectations. They'll show me a picture, I want to look like this, and I'm like, that's not really possible, and that picture may not actually be real. So that conversation may be different than somebody who says, I feel like I've aged and I just want to look younger, and it's their face that they're complaining about. And so that conversation I approach a little bit differently, but in all, basically comes down to a conversation that you have with the patient. You have to sit down, discuss what they want, and then you can tell them what they kind of need and what the best option is for them, whether it be an invasive procedure or a non-invasive procedure. And again, because the technology has gotten so good, it's easier to offer people either non-invasive or minimally invasive procedures that you can do in the office under like local anesthetic or with just a mild sedation, as opposed to having to go into the operating room.
Okay. Now, in your particular case, I'd like you to dive a little bit deeper if you can explain this, because you're a little bit of a mix of both. You're doing the plastic surgery side, you're doing the non-invasive, which is more of a medical spa. But traditionally, what would you say is kind of the biggest differences between the two, medical spa and plastic surgery?
I think that traditionally, if you looked at this 10 or 15 years ago, plastic surgeons did all this stuff, right? The Botoxes, the fillers, all the aesthetics, we kind of did all that stuff. And there weren't that many people in other, fields or estheticians or medical spas that were really that prominent or prevalent. And so over time, I think that industry has blown up and it has grown exponentially. So everybody and their mother offers some kind of aesthetics. And so it could be your pediatrician who's doing your Botox nowadays. It's crazy. So I think plastic surgeons traditionally started doing all these things, and then it just kind of grew into other medical professionals or non-medical professionals, because not everybody's necessarily trained from the beginning to do this stuff. And of course, where you get a certificate after spending 6 hours, it's not the same as being trained for years. So it doesn't mean that somebody can't get a reasonable result, but it's also, if they have a complication or problem, they're usually asking somebody like me to bail them out.
Okay. And yeah, that was actually kind of a good lead up into my next question, as far as you having that both sides of it, and kind of what you said, like that's how plastic surgeons originally started, offering all the services. But how would you say is kind of the biggest advantage? And you kind of mentioned this already, as far as if there's a complication, they reach out to you. But let's say a patient is considering your services versus your traditional medical spa. What would really be the benefits of them coming to someone like yourself, who offers the same services as the medical spa, but you also have the plastic surgery background? What other benefits would that patient see by coming to you instead?
I think it's a delicate balance, because medical spas do have their role. Usually they're more accessible. You don't have to wait as long for an appointment. You can get in and out in a lot of different places. They may be cheaper because I'm not offering my services at a discount typically, right? And so because I know that I can diagnose your problem and not just offer you the same thing over and over again, like filler or Botox, when I think that that's not necessarily what's going to make you happy, or it's going to give you a long-term result that's good for you. Whereas, so if you need an eyelid surgery, like blepharoplasty, or a neck lift or a facelift, because the non-invasive stuff isn't really cutting it for you or is not appropriate for you, I can tell you that and offer you a solution. Whereas a medical spa, while they're able to do a lot of things for you, they can't do everything.
Okay. So you're being in your position, you're able to offer more services. I guess it's more for the patients that looking for that higher end service. They want to go to the expert. Money's really not much of an issue for them. They want to get it done right.
Correct. So I think I can offer the non-invasive med spa services. I think I'm better capable of diagnosing what you truly need, or what will give you the best result long term, as opposed to a quick fix that you may not be as happy with, whether immediately or in the long term. So I think that's the main difference, is just having that experience and that level of flexibility that I can offer a broader range of services, whether it be non-invasive versus invasive, as well as the facilities to be able to do them in. And if you have a complication, actually take care of the complication and not send you off and say good luck.
Yeah. Okay. Now, I'm sure that you get a lot of misconceptions with patients coming in. They're thinking one thing, but it's not right. What would you say are some of the most common misconceptions that you get from patients about the treatments that you provide?
I guess it depends. So if you're talking about surgical procedures, expectations, can be skewed. So people's idea of, what they see on TV and what they see in social media may not be realistic. And so for you're 300 pounds and want to look like Kim Kardashian, that's not really something that I'm capable of doing, or anybody's capable of doing. There are just limitations to what you can do based on your body type and your height and your weight. So if you're not willing to, say, lose weight or do things to get into a weight range where doing a procedure, whether it be surgical or non-surgical, can actually affect you or, give you a reasonable result, those patients you have to have a longer conversation with and say, we have to have a different expectation level, because I don't want to disappoint you. I don't want to promise you the moon and the stars, and then you wind up with a crappy result, or a result that's not what you saw in a picture that you thought you, in your mind, you could get. And so I think that's part of having that level of expertise and having that conversation with the patient to say, like, this is not reasonable. You should be thinking in these terms. Maybe you need to be on a weight loss plan. Maybe I need to send you to a bariatric surgeon first to be able to get you your massive weight loss, and then we can do some body contouring. It's a very broad range of patients that I see. And so it really kind of depends on what your needs or expectations are.
Okay. Now, setting those expectations, you find that it's going to be the same situation whether they're coming and looking for the plastic surgery treatments and the non-invasive as well? Or would you say there's a little bit of a difference between the misconceptions of these two different types of people?
I think there's a lot of overlap. So the non-invasive patients, the Botox, the fillers, the low-hanging fruit is what I consider that. Those patients' expectations are, not as high, right? Mm-hmm. You're coming in because you want to get rid of your wrinkles or your laugh lines or something like that. And that I can take care of with a number of different modalities, whether it be a machine that's in my office, whether it be with Botox or with a filler. But that filler may be something that's off the shelf, or maybe I can do a very minimally invasive procedure where I harvest your fat, process it, and inject that fat as a permanent solution to you, right? And so that doesn't require you to come back every 6 months or 9 months to get some collagen filler injected. It's a permanent solution. It's your own body tissue, and it's just placed where you want it. And so not everybody can do that. A med spa may have that capability if they have a physician or somebody who's, well trained to be able to harvest that fat and do that kind of procedure. But a esthetician is not, even legally supposed to do that sort of thing, right? Mm-hmm. So there are differences as to the level of care that you can get at a med spa, even when it comes to minimally invasive stuff. And that also depends on the state that you're in as well, as opposed to a plastic surgeon's office.
Yeah, okay, got it. Now, I want to ask, when it comes to the balance between how do you balance providing that relaxing experience for your patients, but also making sure that their well-being and their safety is taken into account during treatments, particularly for the plastic surgery side? What's your approach to balancing that?
So, and that comes with experience as well as training. So again, when it comes to the minimally invasive stuff, that's not as much of an issue, right? So a lot of the stuff that you do in a med spa or even in my office, comes in a syringe. You're not really worried so much about harming somebody or causing permanent damage or that sort of thing. Although even with fillers, if you're not careful about how they're injected, you can have some really significant serious complications. But when it comes to the surgical side, I do relatively invasive procedures in my office, whether it be liposuction. We do all kinds of eyelid surgery. We can even do facelifts and neck lifts under sedation or light sedation with local anesthetic. And so because we know the safety profile of the medications that I give, as well as the anatomy and how to give these medications and how to provide anesthesia or local anesthesia in an effective way, based on it's something that can be done in the office in a safe and effective manner.
Okay, got it. Now, when people think about any type of medical procedures, medical treatments, their common perception is that, oh, this is very scientific. There's a step-by-step process on how you do this. But what would you say, what role does creativity play in how you approach patient care, whether it's on the surgical side or the non-surgical side?
Creativity does have a big role. I mean, I think you, as a medical professional, you do have to have the scientific knowledge of the anatomy and do no harm. And if you don't know those things, you can hurt somebody. But you do have to have a creative side. You have to be able to have a vision as to what the patient wants and what you can do for them, because the patient may want something, but that physically you're just not capable of having it. And so there's that delicate balance. And then you also have to be able to see somebody and say, what? I can look at your face and say, okay, starting from the top to the bottom, you need some Botox here. You're missing some volume in your upper face. So that could be taken care of with a filler, maybe with some fat. Your skin is loose. So maybe we can do some tightening with the machine, with the radio frequency or with a laser. Or if it's too loose, the machine's not going to cut it and you need a surgical procedure. So it's a delicate balance that comes with both the scientific knowledge as well as the experience and the knowledge of what's possible and what's not possible with each different modality that we can offer. And so that's where the creative side comes in. I can make this look better with either this machine or maybe not with that machine, but with the filler. And that there goes the creativity side of it as well.
So it is an art and a science, not just a science.
Absolutely. There is, a lot of art to it. Although if you ask me to draw a picture, can't pull it off. Artistic ability when it comes to trying to draw a picture, but when I look at you, I can actually, in my mind's eye, kind of tell what's going to work for you and what's going to look good on you.
Okay, perfect description. Now, Dr. Callahan, I'm sure you've had a lot of challenging cases throughout your entire experience. Would you mind sharing maybe one or two stories about how you had a particularly challenging case come in and you were able to get a successful result for them?
I think that some of the more challenging cases are massive weight loss patients or women who have had multiple children who have lost or gained weight and then lost a lot of weight and had the need for surgical procedures to correct those deformities. So whether it's you've got deflated breasts or a lot of hanging skin where you have to do a body lift and also fix the breasts as well. And whether I can pull that off as a single procedure or whether I can do multiple procedures for time to get you to that level. And so I know I've had some interesting cases where even just recently where I've had a massive weight loss patient, and it was actually a male, but he was a Jehovah's Witness. And so I always worry about Jehovah's Witnesses because they can't get a blood transfusion. So if you have a surgical complication where they bleed, then you're screwed because you can't transfuse them. So those are patients that can die on you. And so this is plastic surgery. You're not supposed to kill anybody. So do no harm. So I did have a patient who I did a tummy tuck on, we found hernias on his belly at the same time, fixed them, did very well, had a great result, but bled post-operatively. And had to go back to the operating room emergently because some little blood vessel opened up when he was moving around. And so that was a very challenging case because you have to rush the patient back to the OR, blood, stop the bleeding, you can't transfuse them. So it can definitely be a more harrowing experience than you're expecting. So other cases which were interesting had to do with like a cancer patient who, and I've seen patients as young as 21 years old who wound up having a breast cancer, who we had to take care of and had to do a reconstruction and recreate the breast and had a really outstanding outcome, was made whole and felt great afterwards. So those cases tend to be the ones that really stick with you and make you feel good about life.
Yeah, and I'm sure a lot of those situations is very emotional after they see the end result, because I mean, I'm sure like all the way up to that time, they just had this emotional and psychological thing about their body that they just couldn't fix, but then they did you, and then you able to fix it, and then just the transformation, I'm sure just the look in their eyes must have just been amazing.
Absolutely. So, and I have aesthetic patients that have major transformations, especially these weight loss patients who feel terrible about themselves, even have like body dysmorphia. And you do these procedures for them, and they're life-changing. You remove all this excess skin, you contour them, and they feel like a new human being. It's a beautiful thing to see.
Yeah, oh, that's incredible. That's incredible. Now, Dr. Callahan, where do you think the future of aesthetics is going?
I think it's going more and more towards the minimally invasive, non-invasive route. I think the surgical procedures that we do, there's still a role for them, but there's the non-invasive and the minimally invasive industry has really blossomed and ballooned. And there's so many different procedures we can do now that don't require anesthesia, that you can do in the office, that you can get done very quickly and have minimal downtime. It just opens up procedures to such a large part of the population that don't have the ability to have downtime, have to go back to work, can't really recover like you need the surgical procedure. So I think that minimally invasive, non-invasive stuff is really going to continue to expand over time.
Okay. And do you think that as this technology has gotten better, do you feel like just the market has grown because of that? People who may have never gotten any aesthetic procedure done before is now doing it because it's so convenient? Or do you think it's more of the people who would have gone for a surgical procedure are now switching over to the non-invasive just because there's less downtime, it's a little bit easier on them, or both?
It's both. It's definitely both. And it's the non-invasive procedures, and it's billions of dollars that are out there with just the non-invasive stuff. And that's why I say the invasive surgical stuff still plays a role, and there's definitely a role for it in many patients, but the non-invasive stuff has truly grown and blossomed over time. And I'd say the last 5 to 10 years, it's really been exponential growth. And I think that's going to continue as the technology gets better. It's getting safer. So people who are maybe less well trained are capable of doing stuff in a safer manner. Because I think that's what, as a surgeon, as a physician, we worry about most. It's like doing things for people in a safe and an effective way. So I want a good result, but you want one that's safe And so you don't want to have somebody have a complication that was avoidable because of technology. Somebody gets burned by a machine because the machine doesn't have the safety profile that just anybody can use. Because if you're really good at using the machine, then it doesn't necessarily have to have as many built-in things to stop you from doing something bad. But as the machines get better, the technology gets better and safer, you don't have to worry about those kinds of complications as much.
Okay, got it. Now, Dr. Callahan, I have one last question for you, but before I ask it, I want to point people to your website at www.callahanplasticsurgery.com. Now, last question is, what would you say is the most important piece of advice you can give to someone who's maybe on the fence about getting some type of aesthetic procedure done, but something is holding them back?
I think that a lot of what holds people back is the fear of the unknown. And so you have to be comfortable with the person who's going to do the procedure on you. So I think that's first and foremost when you go for a consultation, that whoever you're talking to actually you vibe with, that you actually feel comfortable with. And then once you overcome that hurdle, I think it's easier to take the plunge. And so a lot of people have that fear. And once you get over that fear, get over that hump, I think it becomes much easier to actually take the plunge. Financially, I think that there's such a wide range of things you can get that go from low cost to high cost. And so there's something out there for everybody. I think it's just more, who do you feel comfortable with? And I like to think that my patients and my team are very good at getting people comfortable, whatever it is that they're looking for. So we spend a lot of time and effort in making sure that we provide services in an environment that's both comfortable, friendly, safe. And I think my patients really appreciate that.
Got it. Well, there you have it. Dr. Callahan sharing his expertise. Now, Dr. Callahan, where can people contact you in your practice?
They can contact me on my website. That's www.callahanplasticsurgery.com. Telephone number is 201-225-1811. We're open 5 days a week. I have another plastic surgeon that works with me who does transgender surgery as well. We're always available and willing to have a consultation with you at your convenience. No pressure. I'm sure that you will enjoy the experience.
Okay, perfect. Well, Dr. Callahan, thanks for being on the show and sharing your message.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.